The role of sunlight in vitamin D production.
When skin is exposed to ultraviolet B rays from the sun, it triggers the production of vitamin D3. This form is vital for bone health and immune function. People living in areas with limited sunlight, or those who spend little time outdoors, can struggle to make enough vitamin D naturally.
How vitamin D supplements work.
Vitamin D supplements provide a convenient way to maintain healthy levels. They come in two main forms, D2, ergocalciferol, and D3, cholecalciferol. When taken as directed, these supplements can raise blood levels of vitamin D, helping to prevent deficiencies, especially in individuals at risk due to age, skin tone, or medical conditions.
Are supplements equal to sun exposure?
Supplements can make up for a lack of sun exposure, but not in every way. While they help maintain healthy blood vitamin D levels, sunshine may have unique effects. Sun exposure helps regulate circadian rhythms and triggers the production of other compounds, like nitric oxide, which may benefit heart health in ways supplements might not.
Potential health benefits exclusive to sunlight.
Sunlight may offer additional benefits beyond vitamin D. Studies suggest sunlight exposure can boost mood, support sleep cycles, and potentially lower blood pressure. These effects could be due to light stimulating the brain and skin in different ways. Supplements only provide vitamin D. They don't replace these other possible benefits from sunlight.
What science recommends for vitamin D.
Experts suggest a balanced approach. For those lacking sunlight, supplements are essential for bone and immune health. However, moderate sun exposure, while protecting the skin, may provide extra benefits. Always consult a healthcare provider to determine the best vitamin D strategy for your needs, considering your location, health, and lifestyle.